The BAME Vision logo, 4 solid circles from left to right in colours of brown, tan, coffee and beige, with the words BAME written in white within them, with the word vision written in tan underneath, and below the words supporting ethnically diverse communities with their eye health and sight loss in brown.
So welcome everyone. My name's Bhavini, Chair and Founder of BAME Vision. Welcome to the third webinar of the National Eye Health Week series. Today's one's about eye on mental health. We've got fabulous speakers who all have their own expertise. And as usual, we'll have our lived experience speaker who will be sharing more about her personal story and journey, living with a couple of eye conditions, as well as receiving support for mental health. So without further ado, can I please invite Beverly? Beverly's our first speaker, who's a poet, author, historian, and much, much more. And I'm sure Beverly will do a much more better job than me in introducing herself. So Beverly, welcome, and thank you for being one of our speakers today.
Well, thank you very much, Bhavini, and thank you for inviting me again. I'm delighted to be here. Sorry, I've got several things popping up on my screen. I'm delighted to be here again and for National Eye Health Week and to talk about mental health. So yeah, just the small snippet about me. Bhavini introduced me. I also work for Thomas Pocklington Trust as a research manager. In 2020, I set up my own business to bring mindfulness to different communities. And the reason I did that was because of the fact that marginalized groups, which is the words that I use, are the most disadvantaged in our society. So that is why I wanted to kind of change the face of alternative health in a way, try to bring some diversity into that area, that sector. I'm also, apart from doing that work, I'm also a BAME Vision committee member, and like I said, work for Thomas Pocklington Trust, but that's a very recent iteration. So what qualifies me to talk about mental health is through my own lived experience and through the business I run of bringing mindfulness and alternative health to different communities. So so I talk from that experience and from my own lived experience. I also live with glaucoma, which I have done since 2009, I think now, and have gone through my own sight loss journey. So, so basically how I wanted to start really was to talk about just mental health in general. And so when people talk about mental health, you think, oh, well, people often get confused with mental health and think that there's something wrong if you're saying they have bad, in inverted commas, mental health, or there's something wrong with your mental health. We have physical health and mental health, and we need to look after both. So mental health, as you'll hear tonight, encompasses so many different areas. And if we become unwell with our mental health, then that's when it can physically upset us and also make us feel low in our mind, if you see what I mean. So the World Health Organization has a statement that I like to use, and it says mental health is a state of well-being in which every individual realizes his or her own potential, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So I see mental health as a continuum. Okay, so it ranges from good mental health to having poor mental health. And there should be no stigma about that, but of course we know that there can be. So you can live with having no diagnosis of mental health to having a diagnosis of severe mental illness, which then includes things like schizophrenia, with anxiety, depression, those kind of things, where we're suffering from an illness like depression, where it's been given a name. Anxiety, depression, schizophrenia, and then there's a wide range of other illnesses. So how does it combat with our eye health? That's really where I'm kind of distilling this down into something quite small, which is something quite big. So in my work, I'm interested in combating stress. How do we combat stress? Stress is one part of our mental health that can go wrong. Stress is said to be one of the biggest killers in the West, and it can lead to poor mental health. So the results of stress can lead to poor mental health. So we have stress for so many different reasons, but stress can affect our eyes. The results of having stress can affect our eyes. So I will use anything that's alternative, primarily mindfulness, meditation, yoga, mindful movement, to combat stress. These are all the tools I use to combat stress. And we'll talk about those a bit later. And also, in general, as a part of that, I look at diet, talking therapies, and other things that can help combat stress. So looking at why we have become stressed is also really important. So we can become stressed because of lots of different things. So, illness, pain, relationships, our work. Doing too much can lead to stress on our bodies. And then they become illnesses, which includes eye health, eye issues. So chronic stress can result in hypertension, that's high blood pressure, digestive dysfunction, depression, anxiety, and one of the biggest things that I look at is fear. People become afraid and don't want to go out, and then that has a knock-on effect with fear of life, maybe, but just fear in general, just being afraid of anything. Things like, say, if you have an eye condition, you can become afraid of it progressing. Okay. And so there has been some studies that that stress can then make certain eye conditions worse, like diabetic retinopathy, because you're dealing with the vascular system, and macular degeneration. So there has been some studies. So I look at, these are indirect causes of problems with your eyes because of stress and leading to poor mental health. So some researchers have said that chronic stress may be a major cause of visual system diseases such as glaucoma and optic neuropathy or dry eye syndrome. So then we just have the stresses of modern day life, which I've mentioned. So which may keep us in something like what we call flight or fight. And where our bodies are ready, the adrenaline's going, and our bodies are ready. And it's something that's good for us to be aware of having, because we want to be ready for danger. We want to run if something happens that's really bad, but we don't want to keep our body there all the time. But modern day living keeps our body there too readily, causing stress on our kidneys and our adrenal glands. So it might be ongoing work pressure, like I said, money issues. COVID caused so many issues with people's stress, with people's levels of stress, and with their mental health as well. So stress over time can overwork the adrenal system, like I said, resulting in fatigue, poor circulation, and it limits the body's ability to deliver essential nutrients to our bodies and to our eyes, of course, as well. Our eyes need nutrients. We need to have vitamin C. We need to have vitamin D to keep our bodies going, and particularly during the winter months, to keep our immunity strong. And so all these things that have come at us in recent years, COVID, being inside for so long, working on our own, all these things can lead to stress, can lead to poor mental health. So there's some direct causes of mental health, direct causes of stress with our eyes. So stress-inducing eye problems caused by or increased by stress can be dizziness, eye strain, sensitivity to light, eye floaters, eye spasms. These are all things that can be caused by stress and relating to our eyes specifically. So the important thing to get across is that if we just look at hypertension, high blood pressure, one of the results of stress, hypertension is a disease of the vascular system. and eyes rely on the vascular system. So there's no doubt that one can affect the other. So just that one illness that I've mentioned. So if you think of all the eye conditions there are, how can stress affect those? I'm not an expert, but for me, it's common sense. Okay. So some other issues related to sight, I have found are, so if you were diagnosed with an eye condition, you may need to have injections or operations, several examinations, procedures, and this can affect your physical health and make you feel physically sick, unwell, may experience pain, and of course, could affect your mental health by having these new procedures. One of the stats I like to quote is that 31% of blind and partially sighted people are said to be rarely or never optimistic about the future. There's a low percentage of blind and partially sighted people in work. All of these things can exacerbate poor mental health. Mental health, as I said, is a continuum. So your position varies at different points in your life about your mental health. So, for example, where sight comes in, you're not blind or partially sighted in isolation. So other issues may have a knock-on effect in your life, as well as your sight, causing more problems. So bereavement, worsening of your condition, and other ailments that might affect your eye condition, and then your physical and mental health as well. So those are just some of the issues. I paint a little bit of a bleak picture, but I just wanted to make you think about the kind of intersection of mental health and your sight and why there could be problems. Some of it is obvious, some of it isn't. So I'll just pass over to Sandeep now to talk about signs and symptoms of mental illness.
Thank you very much for that, Beverly, and thank you so much for having me, Bhavini, and the wider team on this webinar, a very important webinar, nonetheless, around the relationship and correlation between eye health and mental health. So I'm glad we're having this conversation. So who am I? I'm Sandeep Saib, and I am a living experience mental health advocate or expert by experience. I really emphasize the word living, as it's something that I'm still going through till this very day and on that road to recovery. So just a bit of background to me. I haven't been diagnosed with anorexia nervosa, which is a type of eating disorder, body dysmorphic disorder, and obsessive compulsive disorder. And I'm also a suicide survivor from the years 2012 to 2016. 7 years later or so, I threw myself into advocacy work for mental health and threw myself into the philanthropic world of that, sharing my recovery journey to simply help and educate and empower others to fight against the cause, especially around equality, equity, diversity, and inclusion in the world of mental health. Very, very close to my heart. I also volunteer and collaborate with various mental health charities and organizations to continue making change happen. And I'm all about collaboration and co-production. And without that, nothing is possible, in my opinion. I'm also a qualified mental health first aider, and professionally, I'm a qualified professional marketeer with over a decade of experience in working in various different industries. So in relation to this webinar, I have had first-hand lived experience of severe eye health as well. And in the last 4 or 5 years, I've been suffering from severe dry eyes, as Beverly alluded to. And it's been very, very challenging and very, very frustrating. And I'm here in terms of this segment to talk a little bit more about the signs and symptoms and the red flags when dealing with mental health and eye health. So in terms of general common signs of mental health illness, it can include, and it's not limited to, things such as unusual or illogical thoughts. It could be unreasonable, unexplained anger or irritability. It could also be poor concentration and memory, i.e. not being able to follow a conversation. It could also be signs such as hearing voices that no one else hears, perhaps, or seeing things that no one else can see except you. It can also lead to, other signs can also be increased or decreased sleep, increased or decreased or low appetite, lack of motivation, withdrawing from people, not going to social events, for example, or work dues, wherever that may be. And what Beverly alluded to also is the physical problems. That is just as important and paramount as mental illness health. Physical problems could be such as stomach pain, back aches, headaches, and other unexplained aches and pains as well. And the biggest one here being detrimental effects to your eye health as well. And if we look at the correlation between eye health and mental health, there is, I think I read on Center for Disease Control and Prevention, they mentioned that 1 in 4 adults with vision loss report experiencing anxiety and depression. Those are there, and there are many mental health illnesses, but those are the key, most popular common mental health illnesses that those that are going through vision loss are reporting that they're experiencing. We can talk a lot about the importance of losing your sight and having that detrimental effect and impact on your mental health without the ability to see. You know, you will lose that vital sense that plays a key part in your ability to form memories and interact with the world, for example, accomplishing everyday tasks like cooking, shopping, or even getting around your home, for example. And in terms of going back to anxiety and depression, it goes without saying that people with existing mental health conditions, people that are already diagnosed with anorexia nervosa or anxiety or depression or a multitude of mental health problems, are more likely to develop vision issues here, such as those with major depressive disorders have a greater risk, for example, suffering from glaucoma or dry eye syndrome and age-related muscular degeneration. People with bipolar disorder or schizophrenia are most likely to develop glaucoma in later life, for example. And this is an ongoing debate, and it's still in the talks at the moment. And I definitely want to mention the fact that with eye health and mental health specifically, it can happen to anyone at any stage in their life. Eye health and mental health and the correlation between that does not discriminate, and it can affect anyone at any stage. So it's one of those things where it needs to be on everyone's agenda. It needs to be everyone's responsibility, and self-care is paramount. You need to look after yourself, and that means to look after your eyes and your other 4 senses as well. And when we speak about senses, actually, it brings me to the notion of mindfulness and thinking about your 5 senses and how we put so much on our eyes and how we depend a lot on our eye health. So when we are doing mindfulness or breathing, and one of the notions that I just personally discuss with my counsellor when tackling mental health is we need to be more in tune with our 5 senses. So when there is a problem with one of our senses, we depend a lot on the other 4 or 3 or 2 or 1. So we need to make sure that all 5 are good, in a good condition, and are on that road to recovery. So I'm going to end my segment here, and I'll pass it back to Beverly, who will be discussing the stages of grieving and providing some insightful examples. So over to you, Beverly.
Thank you very much, Sandeep, for that. That was great, very insightful. Um, so I just want you to go on to talk about the 5 stages of grief. So I don't know how many people have heard of this. It's a way of describing the grieving process when you have lost someone close to you, or not even close to you. I've been told it's debatable. So and so I just wanted to talk about how this same concept can be related to eyesight. So the 5 stages of grief is a model developed by a psychiatrist, American psychiatrist called Elizabeth Kubler-Ross, and it describes the emotional journey that we go through after facing things like terminal illness and death. So she was talking about people facing it, that they're actually facing terminal illness themselves. So they were going through the grieving process as they were going towards the end. So she talks about, so she worked with people, I think, who were AIDS patients. I think that at the time, that's who she was working with. So it's since been adapted to understand grief in general, okay, and how we can relate it to sight loss. So there's a gentleman that I've also read who I'd like to add called David Kessler. So he writes alternative health books, but he writes about grief. And that's the subject he writes about. And what he says is that you can relate this concept of the 5 stages of grief to anything. So to a job, for example, losing a job, you can go through these 5 stages. Losing a pet. So if anybody is a pet lover and they've lost their dog or their cat or rabbit, so the 3 I can think of at the moment, that they would know that, you know, you go through this grieving process. You know I have. A relationship or a divorce even. So he talks about widening it. So I think we can widen it to also losing your sight. So the first stage that you go through is denial. So you feel numb, you carry on as if nothing's happened, and it's just hard to believe that this thing has happened to you. So whatever it is, you know, losing your parent, losing your even like losing a, you know, like I said, a pet. Hard to believe it's happened to you. And that this person or thing is not coming back. It's just cut off. One day they're there, next day they're not. So the second thing is anger. So after you go through the denial process is anger. So you experience anger that this person has left you. Some people get stuck there for years, you know, just angry at this person for leaving them. And then seeing death as cruel and unfair. And there's people who are religious who see God as the culprit. And that's, how can God let this happen to me? So being angry. The third thing is bargaining. So you say making deals with yourself or with God, a higher power, going over the events of the past over and over. What if I had done this? I didn't do enough for the person. I didn't help them enough. If I was there, this wouldn't have happened. So, you know, things would have trying to change the outcome. And then 4 is depression, when you just stop and you feel intense sadness at the loss of this person or thing, and you long for them to come back, and you may experience physical pain, as I was talking about and Sandeep was talking about. Physical pain where you, for years, some people don't get over losing someone really close to them. And you're finding it really difficult to get into life, you know, again. You may stop eating, you know, stop going out with friends, as Sandeep said that as well. You know, stop, you know, talking to people, just being on your own, just wanting to be on your own, because you can't imagine life without whatever it is that you've lost. And then the last thing is the coming to acceptance. You gradually find that the pain eases, and you might needed to have gone through therapy, you might have needed to join a group or something to try to help you, okay? And to keep on living with just having the memories of that person, but at the same time, you know that you can then live again and maybe meet someone new, or if it's a relationship, get a new pet. If you've lost a pet, find a new job, etc. So when we relate that to our eyes, it's the same thing. So I just wanted to talk about maybe two of the issues that I've experienced. Okay, so the first thing that I experienced is that a mixture. So one thing I'd like to say is that this doesn't go in order. We're human beings. We're not going to do anything in order. We're not going to go 1 to 5. And this is a model. But most of us will experience some of this, all of it, maybe none of it, but one of it at one time. And then 10 years later, you might then suddenly have another one. So, you know, it's not a science in that way. So for me, when I was first given the news about having glaucoma, I just was numb. And it was partly the way that I was told. So I was in the clinic and I'd experienced these visual disturbances, didn't know what they were, knew that I couldn't see out of one eye properly, knew that the other eye felt odd. And I was just told, well, you won't get your sight back. That's all I was told. And then go away, come back in 4 months, and we'll monitor you. So luckily, being a sort of like a person who can self-advocate, I went and got a different opinion. And that's the other thing, getting a second opinion, not believing what the doctor had told me. So I wanted a second opinion that this wasn't true. So that's another thing. You don't believe, you're just in, you know, I just went, you know, after that, I just didn't want to have anything to do with going to the eye hospital at all. I'd lost the sight. If I got worse, it got worse. And I just completely ignored everything. And this carried on for maybe 4 years. I was eventually going to the hospital and having drops, but one of my eyes was getting worse. And they wanted me to have an eye operation. So the first operation I had was a major operation. And I thought, you can't operate on your eyes. On your eyes. I'd never had anything to do with eyes before. So I had no clue. And one thing I did actually, which I will probably mention later when we talk about ways of helping, I did phone up the RNIB health information line, who really helped me. But I went into denial for quite a while. And just to show you how long, my consultant actually personally phoned me and said, you've agreed to have this eye operation, what's happening? And then I actually went in and spoke to them and etc. But I just was in denial totally. I don't need it. Why should I have an eye operation? You know, they're lying, you know, all this kind of stuff. So that's the denial thing, you know, just completely went into there and was numb. And the other thing I wanted to talk about was depression. I think, you know, like I said earlier, you don't have sight loss in isolation. Everything in your life continues, even though you have an eye condition. You know, nothing stops. Your daughter graduates, your son gets a new job, you lose your job, the negative stuff, you know, someone dies, you know, you have to move, everything continues. Okay, you can postpone things, of course, but some things you can't. So I became very depressed after I had my eye operation, because a knock-on effect for me was that I had a person in my family pass away. So then I had these two things together, where I was recovering from an eye operation and my brother passed away. So the sense of loss for me was just too much. You know, the sense of losing my sight was a loss for me, a huge loss, being an independent person, having to lose assistive technology, having to accept that I couldn't do certain things for myself because I couldn't see properly for a whole year. Very fortunate, I think I was, that it was just for a whole year that I couldn't see properly. But then I got used to having, you know, I got used to the condition after a while. But yeah, so the two things together, having a major bereavement, then having my eye operation at the same time, was just too much for my body to cope with. And I just was depressed. And I think I didn't realize I was depressed until after the event, after I started feeling well. Then I realized that I was depressed. I just didn't want to go out. I didn't want to go out. I didn't want to see people. I didn't go and socialize as much. Didn't do the things that I was normally doing. And I didn't want to carry on with normal life at all. And one of the researches I like to quote for people with sight loss is that it's a high number. So similar to what Sandeep quoted, 34% of people going through low vision clinics suffer with clinical depression. And this was a piece of research done in Cardiff in 2015. So what I'd just like to say before I finish this segment is just, you know, if you are going through depression, you need to seek help from your GP, first of all, first point of call, a counsellor, if you want to talk to someone. I just see counselling as providing that space for yourself where you can just talk about things. So if you persistently feel you don't want to get up, you're not able to eat normally. I lost my appetite completely. You're unable to eat normally, have disturbed sleep, you can't sleep, or you just can't be bothered. That's one of the big things about depression. You just can't be bothered with life. You can't be bothered with your friend, your family. You know, you just completely cut yourself off. So I won't go on. There was just the two that I wanted to talk about. And if anyone has any questions, we're going to provide a sheet with all of this on afterwards. So I'll hand back to Sandeep, who's going to talk about are you talking about coping mechanisms? I think.
Yep, coping mechanisms, Beverly. Thank you. Yes,
thank you very much.
Thank you so much for that. And that's really, really useful to know, and a good segue into coping mechanisms, how to cope with your vision problems and living with impaired vision. So a few of the pointers that Beverly mentioned is, yes, therapeutic counsellor, you know, meeting with your counsellors and therapists, getting support from mental health professionals who is familiar with the effects of vision loss can help you navigate this difficult time. They can provide hope. And I really do think that hope comes also mostly within, and having that self-faith in yourself. Other ways of coping with vision problems is doing, before I go on to that one, I think talking about it is absolutely paramount. You know, when we are going through mental health issues and eye health, most of the time, nine times out of 10, it's invisible. No one knows what you're going through. No one can feel what you're going through. No one can walk your shoes. So that's why it is imperative to talk about it, to open up and to have that conversation with someone you trust, whether it's a family member, a friend, or a work colleague, someone you can confide in. Or it could be someone that has also gone through vision loss themselves that you can trust. It's about bringing that invisibility visible, making it visible. And the only way to do that is to talk openly with someone you trust and confide with. That is absolutely important to do that. And I'd also say, thirdly, I really do think that you are your own best therapist. You know, you are your own best friend, essentially, and you know what you need to do to get through any mental health illnesses or any vision-related issues as well. So I think it falls to us to some degree to learn as much as you can about your condition. You know, arcs and arcs. Research, and research. No question is a silly question. Ask your doctor for resources. Look out for articles, videos, and other content from reputable sources online. And as Beverly alluded to, we're going to be circulating a resource document, so it will have a list of the useful signposting resources on there. Learn. Knowledge is power, and sharing that is going to hopefully help you cope. And bearing in mind, this is a mix of different tips here. So, you know, it's a case of what works for you, but giving everything a try, or a few bits here a try, is definitely going to put you in good stead. You know, if you don't try, you'll never know. Another way of coping is what Beverly alluded to, embracing the grieving process. It is perfectly normal to feel extreme emotions when you lose your sight or when you have issues with your vision. You need to accept that. And I think that formulates a step in the grieving process that Beverly alluded to, embracing it, accepting it. Once you've accepted it and you truly feel it within you, you'll be able to focus on your life, live your life, and know that there are other aspects of your life that need that undivided focus and attention, such as taking your kids to school or going to work or socializing, wherever that may be. Other ways of also coping is to make sure that you explore how the use of assistive devices and adjustment classes can help you maintain your quality of life as well. So helpful devices may include braille labels or text-to-speech software, hand magnifiers, and smartwatches with speech capabilities. So there's always classes and workshops and, like I said, resources out there for people with vision impairment that can teach you things like how to perform basic household tasks and how to label everyday items for easy identification, for example. To add into the mix, there is also general tips on maintaining healthy eyes and a healthy mind. Some of the things which you've probably explored already, especially during COVID, is number one, having a balanced diet, eating well, making sure that you provide your body with the right vitamins and minerals that you need to keep your eyes healthy. Some examples are leafy greens like spinach and kale, fish that are high in omega-3 fats such as salmon and tuna, extremely beneficial. You've got the cod liver oil capsules as well. So making sure that you keep everything within you lubricated as much as possible with the healthy fatty oils from these, to embrace that and to have that, and to have a routine in place with that is important. In addition to routine, to make sure that you stay active. Physical activity produces mood-boosting brain chemicals and reduces your risk of developing conditions that can cause vision problems or further vision problems in the future, such as diabetes and high blood pressure. So advocating and doing more consistent, regular physical activity can only do good for you. It can raise your self-esteem. You know, it can help you can help yourself, and it can help you set goals and challenges. Doing it with your friends and family, doing it together so you're not alone. So it's all around getting involved, and that can also help with your stress, your strength and flexibility as well in your body. I definitely also advocate to not smoke, keeping away from smoking. As you probably know, smoking can damage, yes, your body, but more importantly, damage your optic nerves and increase your risk of eye problems, such as age-related macular degeneration and cataracts, for example. So think about that and try and reduce your smoking. I'd also say to throw into the mix to make sure that seeing your eye doctor is never a one-off. Please see them regularly and make sure you get the comprehensive eye examinations so that we, the eye doctor and yourself can intervene early and identify most vision problems, even if they are in their early stages, to nip it in the bud. So you get the help and support you need that's right for you. And I guess in other coping mechanisms, I think above all, I think it's important to definitely see yourself as a sum of its parts. And what I mean by that is try and be your most authentic self, you know, live life and continue to live life as well. It's hard, it's easy saying that, and it's hard to put that in practice, but try above all to have hope as well. And I'm going to close my segment for this section, and I'll pass it on to Beverly to go through the stress bucket and mindfulness in more depth. And that's going to be really useful. So I'm looking forward to hearing that. Over to you, Beverly.
Thank you. Thank you very much again, Sandeep, for that. Wonderful. So I always talk about the stress bucket or stress container, and it's just a way of kind of trying to understand stress and how our bodies talked about it a bit already, but I I sometimes put up a visual, but you know it's not always appropriate, so I like to describe the container. So if you think of an upside down triangle as your vulnerability, you know, label it as your vulnerability, and it's shown, your vulnerability is shown by the size of the container. So if you have a, you know, a larger container, you're able to cope more with being vulnerable, and if something comes along. If it's a smaller container, you're not so able to cope when things come along. So basically, if you think at the top, the longer flat end at the top is where stress might suddenly come in. Say you have an issue with your eyes, or you've been diagnosed with a serious eye condition, and the stress flows in. And then you might not be coping very well, so it begins to overflow with this stress. And it's an indication of how you're not coping. So if the container overflows, and that's when the problem starts. So it's finding a way at the bottom. We all equipped with a way we can relieve stress. So the bottom of the triangle, there's a tap where you can turn to relieve the stress yourself. And this is what a lot of people don't do. They can keep the stress. So the stress container is a way of thinking about the fact that if stress goes in, how do we relieve it? Okay. How do we get through that? How do we build these coping strategies so that Sandeep was talking about, talking to people, talking to your friends and family, going to therapy? How can we relieve the stress from your container? So when I was diagnosed, I thought my container was quite sturdy. And it was quite sturdy, but gradually the stress was coming in, and I wasn't relieving it anyhow. I wasn't doing anything. I was just holding on to the fear of going blind, the fear of what this condition was doing. My optic nerve had been damaged so much, they said, that I wouldn't get my sight back. So how did this happen? What could I do? So one of the things I decided to do was to learn mindfulness. And I'd always been a bit of a hippy dippy. I'd been one of these people who did all, you know, lots of things with alternative health, you know, I'd always tried something. So I went to the thing to relieve stress that was more at my heart center. Okay, so it was learning. I knew that the issue was, the solution was with myself. So something what Sandeep said, you know, embracing myself and my condition. So it was extremely difficult, but I went off and I did a couple of mindfulness courses, and basically the mindfulness I learned was something called mindfulness-based stress reduction. And it literally is an 8-week course where you learn how to meditate. And it was the only thing that I found that could relieve these headaches that I was getting because of my eye condition. I was suffering from chronic headaches, and I couldn't use the computer for a certain length of time without getting these headaches. And mindfulness was the only way. So what in mindfulness, it's not just sitting on the floor cross-legged and doing some ums. It's not that. It's about learning to be in the present moment and coping with exactly what we're talking now about, coping with whatever is going on for you in your life, trying to deal with that through using your breath, through sitting practice, through mindful movement, through all different types of in the end, you learn all different types of meditations, mindful practice, I would just call it. So one of the big things for me was then wanted to share this with other people with sight loss. And so that's exactly why I set up my business and started going to the community during COVID and offering mindfulness, because it had helped me so much. And I just wanted to be an advocate for it. But also what I'd noticed was that when I went to classes, they weren't particularly VI friendly. So that meant that each time you do a mindfulness course, you get a booklet, for example, and it was all just in very small print. So nobody with any eye condition could read it. You were offered meditations on online, but what if you didn't have a computer or couldn't use your computer? So these were the kind of things. They didn't ask me about my preferred format, basically, when I went to a couple of classes. So I wanted to also educate in the mindfulness community as well. So basically you can do, for me, mindfulness is something that I offer what I believe helps with alleviate stress, because it helps you to be, it takes a long time. It's not, I wouldn't say it's an overnight, it's something that you can just solve overnight. It's a long-term practice, and it's something that you could practice every day and become something that is part of your daily life. And I'm a big advocate for mindfulness being part of your daily life and not being something where it is, oh, I can't do it because I don't have time. It can be simply just sitting in nature, going for a walk in the park with a friend, being quiet and sitting and making a meal for yourself mindfully, eating mindfully. And also it can help at specific times of stress to help with your breathing. So if you all know this thing about breathing, if you breathe up in your chest rather than in your tummy when you're anxious. So we do the kind of, panting thing if we're having a panic attack. So it helps you to regulate your breath as well. So I teach the 5-minute breathing space, where you just 5 minutes of sitting and watching your breath and your thoughts. If you get that far, not everybody can watch their thoughts. So that is why I find mindfulness very helpful. And I describe it as like developing a moment by moment awareness and being in that moment through the sitting practices I've mentioned, like meditation, art, writing, eating, as I've said. You begin to gradually chip away at these everyday situations that you find difficult. And the main thing I think it has helped me with is these spiraling thoughts. What if, the what ifs that lead us off into a frenzy of not being able to sleep, not being able to eat. What if that happens? So mindfulness can slow that down and help us to come to terms with us. And it's very evidence-based now. It's a very evidence-based practice that it helps with many conditions. And there's many different ways of practicing it in the West. The way I teach it is I made the decision to then become a mindfulness teacher last year. And the way I practice is then bringing mindfulness to communities and teaching mindfulness in an adaptive way. So I have began to teach mindfulness together with poetry, which is a reflective discipline. So the two go together very well. And I have to say that writing, because I was a writer before I had my eye condition, writing was another way that helped me out of that depressive mindset. And so that's the other reason I put it together with mindfulness. So I get my students some students have never written before. And it's again, like Sandeep said, being in your senses, developing all your senses, including your eyes. So in the classroom, we talk about how we see. How do we see? And I get people to write about that and think about your other senses as well, and we spend a week on each sense. So I'll stop there. And if anyone's got any questions, we can go on. But I think we were going to talk about support services, or some of them we've mentioned already, but if there's any time, we can talk about a few more. Thank you very much.
Amazing. Thanks, Beverly. And it's great that you mentioned, you're doing just generally sheer amount of work on mindfulness practice, which is definitely up there when talking about and exploring the world of mental health. It's just being in that present moment, isn't it? And being in tune with yourself. And one thing that I do actually, which you reminded me of, is when I need that time to myself and I need a mindfulness moment, I just go to a room in and around the house, away from my own room, and I lay on the floor and I put my right hand to my heart, close my eyes, put headphones in, and just listen to the inner workings of my body, the heartbeat, and everything that goes in between. And that really helps me if I do that 5 minutes, and I've been doing that every day, even if it's 5 minutes or 10 minutes, whatever it may be.
Yeah.
Dedicate that time, and that is self-care, looking after yourself as well, and reconnecting yourself and staying grounded. So very, very powerful. Very powerful. So in terms of support services, and myself and Beverly will go into this now. I'll cover mental health a few of the links that I want to mention, but most of them, if not all of them, are going to be in that resource document that will be circulated after. But a few of the support outlets from a mental health perspective is mental health charities. In short, over time, there are many that have come to fruition and have been established. To name a few, Mind Charity. So Mind Charity provide general advice on various different mental health illnesses and provide that support and advice to people and help empower them more than anything. Anyone experiencing mental health problems and also eye-related issues as well. There's also Samaritans, 24 hours. They are there for you 365 days a year. I am a volunteer for Samaritans and Mind. So they are there. Whatever you're going through, they will be able to help you. You can give them a call, drop them an email, and you can also visit the branches locally as well. So they're there for you and they're there for a reason. So please do use them and reach out to them. Rethink Mental Illness is another charity. For those that don't know, many years ago, it was the National Schizophrenia Charity, and they've now had sort of a rebrand a couple of years ago. So they are similar to Mind, a charity that believes a better life is possible for millions of people seriously affected by mental illness for over 50 years. So 50 years they've been advocating and supporting people with mental ill health. And eye health is very much part of their agenda. And that goes for any particular illnesses out there. And to round up the last few, I'd also mention Mental Health UK. So Mental Health UK brings together the heritage and experience of 4 charities from across the country. So again, supporting people with their mental health for over 50 years now. And the last 2, Mental Health Foundation, a UK leading charity. And I'd also say MHFA England, which is UK's leading mental health training provider, running various different range of health and wellbeing courses and training as well, equipping oneself with the knowledge around mental health. And I think that's it from me. And I'll pass it on to Beverly if she has any further support services to throw into the mix there. I'm sure there's plenty more.
Yeah, there's loads more. I thought it'd be interesting to mention some of the mindfulness apps and organizations. In London, that we are lucky to have, particularly since COVID, these mindfulness organizations who have been working online and sometimes offer free sessions if you are IT literate and you would like to try some mindfulness out, there's the Mindfulness Network who I trained with, and they have a free Friday morning session. I can put that into the resource list. I think I forgot to put that one in. Free Friday morning session where anyone, members of the public, anyone can join and use half an hour mindfulness. So if you just want to try out mindfulness, you can use them. Also, there is the Mindfulness Project. They're London based. They work in London, but also work online as well. And I've spoken to them about working with people with sight loss, and this was before COVID. We were going to collaborate on a project, but then after COVID that didn't happen. But they're very interested in working and open with working with people with sight loss. Also Breathworks, they're another charity, and these are all charities as well who are open to working with all different groups. Breathworks, who run loads and loads of courses and have free courses online now. And so you can do a small course online just to find out if you want like mindfulness. So gone are the days when you have to find a class and you go along, you can just work online with these. So I use one of the first mindfulness apps. I mean, they're meditation rather than mindfulness, but they have a mindful approach, is Headspace. And they're brilliant. They have these short courses that you can try. A lot of the apps you do have to pay for now, but they sometimes have these free bits, so you can use them free for like a month, and then you go off and do a course, or you can just use that over and over again. So Headspace, and you can go onto the Play Store or the App Store and find these. Calm is another one. I found Calm quite useful. And then there's the Mindfulness app as well. That's another newish one, which I found. And they have many different types of subscription that you can use. So I sometimes go on and trial them so that I can tell people about them. So those are the three that I have used in the past. So let me think if there's any more.
Beverly, because we're going to be sharing all of the resources that both you, Sandeep, and additional ones in the resources, which we're going to share with everyone. Is it okay to bring Eamonn in? Because I think we've just learned so much about how, the links between eye health, mental health in relation to sight loss. And do you get symptoms, you get signs of, peripheral loss, or maybe color blindness, or, blurry vision. You start off with symptoms that you might not necessarily know what it is or what it could lead to. And, stress, anxiety could actually start from then, especially if you've never known anyone else to have those symptoms and you're wondering what it could be, and then waiting for that appointment. You finally pluck up the courage to book that appointment with your optician just to see what's going on. And then that's it, they may refer you to a consultant. So there's waiting. And again, it adds to your stress. You're anxious about what are they going to say? Why am I experiencing this? Especially if it continues. Then you're waiting for that appointment, you get your diagnosis. And again, I mean, there's so many aspects to it, just waiting and not knowing, and then having it confirmed. And, the isolation period, the grieving stages that you mentioned, it's just so common. And again, you may not know about the different stages of the pathway, which Eamonn's going to come and speak about. But again, accessing all of that support. And if you don't even know about the pathway or even get access to it, all of these symptoms, both you and Sandeep have mentioned, can actually affect so many of us, especially if you don't get a chance to speak to other people going through the same. You don't get that support. You don't get to speak to an ECLO. You don't get support from a rehab. Does everyone know what a rehab does? You might get to that point where you've got to start learning to adapt things in your home, your kitchen, the way you work, the way you access information, learning technology again, and just having a voice to rely on because you can't physically read anymore. Plucking up the courage to get that cane training. holding a white cane for the first time, you know, what's everyone going to think? How do you feel? Waiting for those sessions. And then again, when you might consider having a guide dog, for example, being on that waiting list. And as we all know, I mean, I think it's getting down now, but since COVID, we knew that the waiting list was exceeding. So what I'm trying to say, there's so many elements to someone's life where we could experience these symptoms. And I think, Eamonn, if I can bring you in, welcome. And
thanks, Bhavini.
Work, you know, on the Pathway project. And could you let us know more about what it is and what's going on in the sector?
Will do. Can you hear me okay?
Perfectly, yes.
Great. You can't see me because my camera won't connect, but that's okay. Yeah, hi everyone. Really pleased to be able to join you for this important discussion this evening. So yeah, as Bhavini says, I'm Eamonn from the Partnerships and Projects team at Pocklington Trust. I have a special focus on all things health, mental health being a very important component of that. You have to forgive me because I'm in a hotel at the moment and I can't really stop the noise from outside in the corridors and stuff. So forgive me if you hear chatting in the background. It's just that people are having a nice time in London, so that's good. So I have lived experience of anxiety and depression, but I'm doing very well at the moment, I'm glad to say. I'm also a qualified mental health first aider. And at the moment, in relation to sight loss, I've been supporting my mum, who's 87 and doing brilliantly, on her sight loss journey. She has multiple conditions, including macular degeneration. She's also experienced some aneurysms as well in a good eye, which has worried her quite a lot. But I'm very pleased to say that yesterday she got a very positive outcome from her consultant, saying that she didn't need to have an operation. She thought she was pretty much going to have. So she's very pleased about that, and her vision has improved dramatically. So fantastic. And she's given me some really good insights into how she's accessed peer support, which has been invaluable. You know, people who are going through the same thing, who understand what you're going through. It's absolutely so powerful. So I live in Alnwick in Northumberland. So everywhere takes a long time to get to, so I'm very good at traveling. So what I'm going to talk about is just pick up on the kind of what is the vision impairment charity sector, what's it all about, you know, what are we doing, and what are we doing about mental health, more importantly. Both people who are going through the sort of sight loss journey, as it were, sounds a bit corny, that doesn't it, but people who are going through the process of not knowing, you know, and waiting for the next appointment, imagining all sorts of things, not being told the information they need to fully form an opinion because no one has time. But also people, you know, who may have lost their sight or never had sight, you know, it can creep up on you, as Beverly says. You might feel fine 1 minute and something could just, you know, come out of the blue and really impact you. So 3 things I'm going to cover. What the VI charity sector is, what the visual impairment charity sector actually is, and why do we need to do something about mental health? Secondly, what are we doing and what difference will it make? And the third thing, which is quite important to me really, is what do you think we should be doing? You know, it's all right me saying we should be doing this because research says this, but what are people experiencing in their daily lives that we really need to know about and perhaps we're not picking up on? So it's really important that you people on the call or have family with sight loss do have a voice and can steer what we do. So firstly, the VI charity sector, what is it? It's basically just a group of organisations that have come together, which I think we've always worked together. The charities, you know, Blind Veterans, Glaucoma UK, Guide Dogs, Macular Society, Retina UK, RNAB, Thomas Pocklington Trust, and there are many more, all doing specialist work in different areas of sight loss, which is amazing. But we haven't always worked together and harnessed our power, which I think is something that COVID made us kind of think about more. So we sort of formed a partnership called the VI Charity Sector Partnership. And we have, in the partnership, we have a number of different committees and streams of work to focus on issues like mental health. But why do we need to do something about mental health? I mean, surely, you know, as we've heard, there is support available. But, you know, in a recent report we did last year's National Eye Health Week, the IQ report, 76% of people living with sight loss said their mental health had been affected. That's a lot, I mean, which is kind of a surprise, and certainly to many people here. And actually, only 17% of blind and partially sighted people are offered support with their mental health and emotional well-being when they're losing their sight, because they don't connect with the eye clinic liaison officer, or nobody thinks to mention it. The ophthalmologist just assumes it's all everybody else's job, etc., etc. So they just don't get that support, or there's a stigma about it, or for many other reasons, they don't actually access vital support with their mental health. And I think, as someone said earlier on, 4 in 10 people attending a low vision clinic have been found to be suffering symptoms of clinical depression. So that's awful. But even if you do get referred, if you're lucky enough to kind of pick up on some support, mainstream counselling services and other support services aren't very accessible generally. Not only are they not accessible practically, but the person you're speaking to might not have any experience of the impact of sight loss on a person. So whilst they might generally understand depression or anxiety or all the other conditions that can manifest, they just don't have that experience of what the sight loss journey and the grieving process is all about. So all of this adds up to a health inequality, or health inequity to be more precisely, so it's more precise about it. So people with sight loss are at a disadvantage when it comes to accessing mental health services, and that's not good enough. It's not good enough because of the impact it can have, but in simple terms, the Equality Act and Care Act and lots of other legislation exists to give people a reasonable adjustment when they can't get access to a service, and that's not happening with many things. So we need to do something about it. So what are we doing? So as I said, during COVID, we all got together, RNIB, guide dogs, etc., and we formed this partnership, and we said, well, what are we going to do then? It's all very well sitting around talking about, well, what are we actually going to tackle? And of course, one of the main things that came up was, the people's mental health generally, but particularly during COVID, where they couldn't meet the people they'd normally meet. They couldn't go to funeral, all of the things, which I'm not going to go into because, it's just too depressing. But we all know what they are. And that was a particular acute need that we needed to tackle. So we formed a committee, which is chaired by a very, very qualified person from RNIB called Amanda Hawkins. And we set about a number of different work streams. So given what I've said, one of the things that we've noticed that mental health staff in general don't have knowledge of sight loss, and certainly the accessibility problem. And I'll give you an example of that, how sight loss loses out quite often. So there's something called talking therapies, which is an NHS-funded sort of work stream that funds local talking therapy. So if you get referred by your GP, or you can refer yourself actually to a local talking therapies service, the chances are that practitioner won't have had training in mental health, in the aspects of mental health that are impacted by sight loss. So what we've done is, with RNIB and various other people, we've got a training package for general practitioners that they can do that's free at the moment. So anybody who is a counsellor or another kind of a psychiatrist, even whatever the kind of specialism, can do this course, and then we'll go on a list of people that have qualified, so that a GP, for example, can refer someone with sight loss to that service. So they'll be kind of sure that person's got some idea of what they're going through, and not having to spend the first session or two just explaining what sight loss is about, which is what happens. Okay, the next thing is to kind of understand what services do exist. So a lot of sight loss charities have got some really good counselling services, often delivered by people with lived experience, which is fantastic. It's an employment opportunity as well. But it's fantastic because people feel, less stigmatized about getting support from someone in a sight loss charity they may already be accessing the services of. So it doesn't feel so stigmatizing. So we've done that, and it, through various things like the RNIB Sightline directory, which you can add to the resource information. You can search your local area and it'll tell you, or you can just phone RNIB up, if you don't want to use the internet or whatever. But they can tell you where a local service exists. It's not perfect because it's hard to keep it up to date, but it's pretty decent. So the other things that we're doing, and again, this, my role is around health, is looking at the overall kind of workforce within mental health, and trying to make sure that from not just when people are actually in practice, but when they're doing their training. So, and it could be an ophthalmic nurse, it could be just a general nurse, it could be anybody involved in healthcare, just to make them aware of some of the things that people with sight loss kind of, can become affected by when using health services. I mean, maternity services is an excellent example. And we've spoken to some of the course curriculum people at one of the universities up in the Northeast. about upskilling maternity staff at all levels, not just midwives, to understand what it's like to go through the process of giving birth while blind or while having reduced vision. There's a lot of other little things that we're doing, and just but basically there's the two aspects of it are really to make sure that mainstream services are as accessible as possible, so that you don't have to use a specialist service, and you won't have to kind of explain every time you're going through the process that what your particular issues are. Other than the natural kind of the way that those services do reflect on what your particular needs are, but not generally about sight loss. We're also working with there's a project I'm working with in Dundee in Scotland, in a macular clinic, and that's because the ophthalmologist recognised that people going through the clinic were suffering with various mental health issues that he didn't really understand the background was, but he knew it was happening. So he got in touch with the local university, aAdvocate, and a brilliant person called Mary Thurston, who's a sort of recognised expert on this sort of, she's visually impaired herself, on this topic. And now there's a project going on there to kind of provide peer support to people going through macular degeneration. And there's lots of other little things that we're picking up on all the time. One of the things which, just before I go into the kind of and just ask you what questions you've got after we've heard from Perm, is people with mental health problems. We haven't researched it. This is something we're just looking at designing. But people with mental health problems, we think, are far more at risk of having undetected eye conditions, purely because of the nature of significant mental health or serious mental illness can get in the way of other health conditions being recognised and treated, and also because most of the mental health system, which does do physical health checks for their patients, especially those who are seriously mentally ill, it doesn't include sensory impairment, so they're not picking up on these things. So I know anecdotally from speaking to mental health staff in the NHS that they're having patients who they know have got eye conditions, which apart from anything else is exacerbating their mental health, but nobody's picked up on that. No one's making referrals to ophthalmology, which is often in the same building. So we're trying to make sure that everyone using eye services gets mental health support, and everyone using mental health support gets eye support. It's kind of obvious, really, that should happen, but it doesn't happen because the way things in the NHS tend to be planned a little bit in silos. But so that's what I wanted to say. Really, over to you now. After Perm has spoken to anybody else, is what do you think we should be doing as a sector, the sight loss charities as a group? What would you like to see us doing more of in terms of mental health particularly? So I think that's it from me, Bhavini.
Thanks, David.
So it's over to Perm.
That in the chat, what that question about what is it that you would like from the sector, we can open it up in a little while, or put it in the chat as well. But I really would like to hear from Perm. Mental health, receiving support, just talking about emotions and feelings, it's such a huge taboo in so many of our cultures. And even just the word of blind or vision impairment, acceptance, coming to terms with it, it's not something we really talk about. We try and brush it under the carpet because of the fear of extended family and the wider society in our communities finding out. So I think Perm's got an excellent story to share with us. And Perm, if I can bring you in, please introduce yourself and just tell us a little bit about your journey.
Thank you, Bhavini. Firstly, can you all hear me clearly?
Yes, we can.
You can. I'd like to say thank you very much for asking me. It's been amazing to hear Sandeep, Beverly, Eamonn, and obviously yourself. And well, my journey actually begins, I was just counting the years. It's been 2 decades when I was diagnosed. So my name is Perm Bachu. My full name is Permjit Bachu, and I was diagnosed with an eye condition, which was through a routine eye examination. And I only went because at the time my daughter needed glasses and she kept going nearer the screen. And I kept pulling her back, and I thought I might as well have my eyes tested while I'm here. My daughter was out within a few minutes and I was there 2 hours later. And I'm thinking, is this normal to have an eye checkup for this long? Now, bearing in mind, folks, this is before, 2 decades ago, the clinical pathway has changed. There's a different holistic pathway. But I was then actually checked over and over, and the pharmacist the actual optician who checked me said, there's something wrong with your eyes. And I thought, what? She said, your acuity's good, your peripheral vision's good. And basically I was told to go straight to A&E. She gave me a letter because she had found something which wasn't, normal. So I had to kind of go back, and I was driving at the time. And then I was fast-tracked to having some eye appointments at the hospital, which were really gruesome. So tests were quite horrible. And when I was given the devastating diagnosis, I saw the consultant. He said, your colour vision's good, everything else is fine. But there is a problem. We found something when we did the electro test. So I was told I've got a condition called retinal dystrophy. And he says, there is an issue. You've got swelling at the back of your eye. I didn't realise it was macular edema. And he says, we'll manage it with tablets and we'll see you in 3 months. And I basically was chaperoned out the door and given a load of leaflets and told to get on with it. I was not told how this was going to affect my life. Didn't realise it was going to turn into blindness. And I came outside the consultant's room in shock. And I sat there thinking, the 2 people that were with me are no longer alive anymore. And they sat with me, and it was devastating. I could read the print, no problem. And I said, what on earth is rod cone dystrophy? Then there was no ECLOs at the time, folks. ECLOs are a new concept, which are absolutely vital to the service. So I was emotionally distressed, never mind the physical diagnosis I was given and not knowing. So I kept being seen every 3 months, and the thing was the same. Oh yes, the swelling's going. We've got to make sure you don't go blind. It's when that word was mentioned, and I thought, blind. I said, what do you mean blind? And he says, oh yeah. He says, your condition is progressive and it's genetic. So I didn't realise that was actually prodigy of my parents having 2 defective genes. Fast forward now to more or less 5 years previous. 2018, I actually carried on working, carried on driving. And it was then slight changes started to occur in my life. I started to suffer with night blindness, sensitivity to the light, which was horrendous, cataract surgery, one after the other. And it was horrendous. This took toll over many years. And in that time I was still in denial. I was very, very angry and upset, and my mental health was absolutely failing me. And I didn't address it because there was nobody there to bridge the gap. I didn't hear of eye care liaison officers. They didn't exist. They've only been around the last, I'd say, 10 to 12 years. Anyway, so my life then changed as I kind of, obviously, progressive deterioration. It carried on and it wasn't going away. And I thought, this isn't going to go away. And then I had genetic testing, and that's when it was confirmed that both my parents were the defective carriers of the defective gene. And it was diagnosed a few years ago that I've got Usher's as well, which could affect my hearing. Touch wood, it hasn't at the moment, but I went through genetic testing, which is through a simple blood test and also through a simple counselling service, which I had through the genetics clinic. And I'm seen at one of the top hospitals, which I, say are brilliant Moorfields. But in that time, I didn't know about Rovies. I didn't know about rehab officers and exactly what it meant. But my mental health was really getting bad. It got to a point that I lost everything, because I lost a career. I left and I became a recluse. And I didn't leave my parents' house for 3 months. I didn't shower. I lost my identity, my financial freedom. I didn't know where to go. I was at the lowest point of my life. And it's quite painful to talk about it still, because it stays with you. So not only was I still in denial about my sight loss, about being blind, because I kept tripping over, and I hid it very well. I didn't have a cane at this point. And it was getting to a point that I was walking into walls and, walking to the bush because I couldn't see in the dark. And I was in denial for a very, very long time. And believe you me, it was not a nice place. But it was affecting my family, because I'm from 2nd generation Asian. Parents are 1st generation, very proud. But it came to a crunch point when I was avoiding family weddings. I got dressed one afternoon and I just couldn't go out the front door. I was hyperventilating. I couldn't breathe. And I said to my father, I can't do this. And I went back to bed. I stayed in that room for many weeks. And it's until that day they came back. It was affecting my dad and my mom, my inner support network. And they said, our girl's not going to make it till Christmas. I had become that bad. Didn't know who I was anymore. Lost my identity. And I lost a lot of friends as well. So there was nobody there but my family. And the only time it became apparent the barriers that was put in my way is when I had the cane. I actually stood in front of the mirror and actually accepted my cane, a pink cane, because I didn't want a white cane. And I called her Ethel, and she's still with me everywhere I go. She's had a few bumps and grazes along the way, but that's when I stood in the mirror and I accepted who I was. And my parents found it very hard to come to terms with is when I walked into a birthday party full of all my extended family and immediate friends. And the Asian community can be very unforgiving, and my experience was not very nice. And I walked in and they says, oh my gosh, what's happened to her? And it was actually the women that were the rudest. My uncle, a strong Geordie man, said, oh my gosh, what's happened to you? And because I had hid it so well, they didn't see the hidden bruises I had, the emotional scars I was carrying. And that's when they were all asking my parents. Instead of talking to me, they were talking to my parents because I felt invisible. And I think Sandeep actually mentioned this. I didn't feel that they were seeing me. They were seeing my cane. They were seeing, and they were talking to me and they were shouting at me as if I was deaf, and I wasn't deaf. And I just said to one of my aunts, I said, there's no point talking to my parents. Why don't you talk to me? They said, well, what happened to her? It's like I was a third person, and it was a horrible experience. It wasn't nice. And I became more defiant and more angry. But that's when I wanted to actually turn around and change it into a positive. So I then had serious rehabilitation when I was in a really dark place, because I don't think I'd be sitting here today if I hadn't spoken to my primary care team, my GP, and I said, I need help. I was on medication, and believe you me, and I'm still on it. I'm not ashamed to say, but I wanted to be a role model and understand what VI meant, visual impairment, because I wasn't totally blind. And then I actually had RNIB counselling, so I picked up, and they said they were there to help me. That's when my journey began in 2019. Fast track now to 2020, then we had COVID, so isolation came a thing. I started to get my groove, then I was set back again. But I retrained, and I did all of my training online. I did basics in counselling, mentoring, and also the information, advice and guidance. But it gave me the strength, and I didn't have that fear factor anymore. I wasn't ashamed to be out in the street with my cane. If anything, it gave me empowerment, and I was visible, not invisible. But even though I still go out, I still try and avoid, large crowds, because I do have anxieties and I do have a routine. But it's given me a lot of joy as well, and I'm pushing the boundaries. And it's to show people that it doesn't matter what community we come from. The barriers are already there. I mean, one of the ladies actually said to me at that one family gathering, oh, can't you wear glasses? And I thought, typical. When are we going to keep... I kept having to explain myself. And I thought, I don't need to do this anymore. I don't need to explain myself. If they can't accept me, then they can jog on, not me. I will stand tall and proud with my cane. Ethel has got me out of some many little holes. And believe you me, I wouldn't be without it, but it's who I am now. I walk tall and proud. And I also like to actually know that there is hope. And I've done many, many talks now. And I found my love for art again, because that was my previous career. The career I'm doing now, and I fought hard to get a job as well. I didn't work for 4 years, and living on the benefits was not good, especially if you've had that financial freedom. And I thought I need to do something and be proud again. Now I know I've got Ushers. I also have still macular edema, so I do administer eye drops very badly because I end up all over my face. But I also have Charles Bonnet, which was diagnosed this year, which is visual hallucinations, and quite funny, some of them, but it's managing those conditions. And I just laugh. And I actually do deliver a sight loss course, which talks about all the services that I didn't connect to in the beginning. And in my professional role now, I'm very proud to work where I am, but I also did volunteering, and I continue to do volunteering for the various sight loss charities, and Retinal UK are one of them. Very close to my heart because they do a lot of research in inheritable retinal diseases. And I hope one day there's a cure for blindness. And the one thing I would like to say, folks, I did actually do an ad campaign earlier this year to highlight how important counselling is. And I still have counselling. I do dip into, the counselling service time to time, but I want to be a strong role model, and I'm learning about sight loss all the time. And being invited today, I'm very humbled, and I feel very proud to be a strong Asian woman, just like Vivini and everyone else here. And I've got no fear factor. My parents can't keep up with me now. My family says, what is she doing? So I can laugh, and I laugh at myself. If I trip up something, I thought, oh, well, I didn't see it. So but I can make that joke, but it takes a long time to get where I am today. And I still continue to do mindfulness, which is really important. I'm very spiritual. And the one thing that's kept me still strong is my family, and that's still behind me today. Some of the people that were with me have sadly passed away, but I hope they're looking down on me and being proud, because disability does not stop, so why should we? Thank you. That's my story, everyone.
Thank you, Perm, so much. And you are absolutely a strong Asian woman, and you're living proof that actually you can go through all of that, but there is light at the end of the tunnel. And I just want to say thank you for sharing your journey, because I know it's not easy, but you did it so eloquently, and and just providing that hope for others as well. So I just want to say a big thank you to you and all of our speakers. And I know we've kind of run over time in terms of Q&A, but we will get to them if people are still happy to stay on for another 10 minutes or so. If there's any burning questions people may have, if you do want to put it in the chat, we can come back to you, but let's open it up to see if there is anyone that wishes to ask a question or comment. Minal, is there anything in the chat so far?
At the moment, no.
Okay. Does anyone have a question? It's all right if you don't want to put your hand up, you can just unmute.
Oh, Vivini, there is a question, just noticed, just come up in the chat from Aaron. Aaron, I never know how to say your name. Is it Aaron or Aaron? Forgive me. Do you want to do you want to actually ask the question in person? Or do you want to read it out? I'll read it. Oh, hi, you're there. How are you? Hi.
It's Aaron, but I'm not offended either way.
I've seen you tomorrow.
See you tomorrow, yeah. So I've got a question, and then perhaps I can save my comment for I can email my comment about about the sector and what I think might be needed. I suppose my question to anyone really would be, how would you go about supporting someone else who is going through a difficult period in their eye health journey?
Who wants to take that question first? I guess multiple people can answer that one. Perm, first? Yeah.
Vivini, can I interject?
Yeah, of course.
I think the most important thing, hi Aaron, thank you for asking the question. I think it has to depend on the individual as to where they are, because even though we might have different visual impairments, it's not a journey. It's actually a lifestyle change and adaptation, and they have to accept the help and accept it themselves first, because that is the first journey, I think, is acceptance. And personally, I think it depends on the individual. The resources are out there. They're more available than they were 20, 30 years ago. And we're in a ever evolving, kind of world. Technology plays a key part to adapt as well. So for me, I think it's the individual. And to say that, we are there, but they have to meet us halfway as well. So you can do the work, but sometimes, you know what they say, the individual has to meet you halfway. We can walk with you forever and forevermore until that time you say, no, I can do this. And that's when the journey begins.
Thank you, Perm. And Aaron, you had a comment, did you say?
Sure, if there's time. I was just going to say thank you, Pam, for that answer, by the way. I was just going to respond to what Eamonn was saying about what might be needed in a sector, what the sector should perhaps be looking at. And something I've kind of noticed is in terms of counselling services for visually impaired people, there tends to be quite a waiting list. I didn't know if it would be a case of the sector looking how you could increase the capacity for those services, or whether there's something else that's perhaps needed. That was just my comment, but otherwise, yeah, appreciate your time this evening, and yeah, thank you for a fab session as always.
Thank you for joining us. Does anyone else have a question or a comment?
Mary says, thank you, Perm, and all other speakers for sharing your experiences and living with VI conditions. Aaron's already asked that question. Let's have a look. Nicola says, thank you everyone for sharing your stories. What awareness program is available to share with the workplace? I work with the NHS and my experience has been very negative. It has been like, yes, you have glaucoma, carry on.
Sandeep, do you want to take that one with the variety of hats that you wear and give talks to? Are you aware of anything?
What awareness programs are available to share with the workplace? I think if we're looking at, because there tends to be those that are tailored for mental health, and there tends to be those that are tailored for eye health. I think most of them, if not all of them, are going to be in the resource document itself, so they will be in there. But I guess the one that comes to mind is, there's many. So there's Unmind app out there, so that's an awareness program available within the workplace. There is also other services such as Efficacy as well out there that workplaces provide, and it's mainly tend to be led by the HR and Wellbeing Board and the relevant colleagues within the firm. But most of them, if not all, will be in the resource document, so I don't want to spend too much time on that, if that's okay, from that side of things. Yeah.
And we will be sharing that resource document with you all, along with this webinar recording, most probably towards the end of this month.
Bhavini, may I just add to that point very quickly as well about the workforce and workplace. Yeah. One of the things that ourselves and RNAB through the partnership are looking at is, because we've always done vision impairment awareness resources, and we haven't ever really talked about the emotional impact. It's just mentioned it in passing as one of the many things that we talk about, but the feeling is amongst the partners now is that we need to be saying, just as importantly as anything else, really, mental health, emotional well-being, whatever you want to call it, couch it, brand it, whatever, has to be an integral part of that vision impairment awareness. So just so that it's on everybody's mind. And I think working with the likes of the universities to adapt the curricula so that, it doesn't get overlooked as the way it often does. So example, maternity, if you're doing a midwifery degree or masters in a major university in the Northeast, you get 3 hours of pan disability awareness training in the first year. Okay, that's just totally inadequate, and they accept that, but no one's ever challenged that before. And I think that's because people with lived experience aren't getting in at the point those services or those whatever it is that we're looking at is designed. So I think the work of the sight loss councils and others in that sort of fields to try and influence at a local level some of those services is just brilliant, and it's just making such a difference.
Yeah, thank you for sharing that.
I think just to add into the mix really quickly is allyship. So having ambassadors within the workplace that champions causes like vision loss and mental health is absolutely crucial. They are, I guess, in my opinion, the driving force in driving the agenda for change within workplaces. So having allies on your side to support this cause, whether they are directly impacted or not, really helps in the workplace, I think, in my opinion, to champion the cause that bit more. So I just want to throw that into the mix there. Apologies.
Yeah, thanks. Was someone going to come in there with a question?
Julie's got a raised hand.
Julie, hi, Julie, go ahead.
It was me, Bhavini. Sorry, I couldn't find my hand quick enough. So I'll be really quick. So I'm Julie. I'm the programme manager for the Eye Care Support Pathway at RNIB, and it's just to say that Amanda Hawkins does work with the NHS around awareness raising and training, so I can pass on her details if you want to contact her directly, or if you want to give me your details, and I can, whatever way, we are doing work in that area, and I'm happy to share information with you. So I just wanted to say that.
Thanks, Julie. Thank you so much. Whilst we see if there's anyone's got any other questions or comments, because it's a bit of a selfish request, it really does help with the future of our webinars. If you can complete the poll, if we can launch the poll, and if you're able to, because I know some people may not be able to, if you can, it would really help us if you can complete the short 5 questions. And whilst you're completing the poll, if there is anyone with a question, or if there's something in the chat, we can go to that. But if you do think of anything after today, feel free to email us, because I can, bring your question or your comment to any of our speakers, and we can email you back with a response. So don't think this is it. If you do think of something later on, even next week, please do get in touch. Even if it's just a comment, or you have a specific question. Minal, is there anything in the chat since the poll has been launched?
Bhavini, Sabia Patel asked, how do I contact Beverly?
Beverly, are you happy to share your admin email? We can share that with everyone if that's the one you want.
Yeah, I'm happy. Yeah, I can put that in the
chat.
I can put that in the chat.
Yeah, so Beverly will put her email address in the chat, and we can circulate that along with the resource document and the link to the webinar recording once it's available.
I don't have a question, but I requested if I could read my poem.
Yes, Urmila wanted to share a poem.
How long? Sorry, because I know we've run over time.
Less than a minute.
Less than a minute? Oh, all right, go on then.
It's about my own journey. Me, myself. The time that my journey has taken is long, and the way of it very far. I came out of the gleam of light and pursued my voyage through the wilderness of worlds, leaving my footsteps on many a lands, cities, hearts, and minds. It's the most distant course that comes nearest to thyself, and that training is the most complex, which leads to the simplicity of a path. Me, the blind traveler, has to knock at every door to come to my own, and I have to wander through all the lands to reach the innermost destination at the end. I hold myself tight. My finger eyes feel hither and thither in the darkness, and said, how art thou? The question and the cry, oh, where? Melt into tears of 1 trillion drops rolling down my cheeks, and deluge the world with a flood of the assurance, I am hither. I am hither. So I enter the world within, my beautiful shelter, no fear, no pain, just bliss.
Oh, thank you so much for sharing that. That's so relevant. Did you write that yourself?
Yeah.
That's amazing. Well done. That really is amazing, and thank you so much for sharing that with us.
I had to read it quickly, so I couldn't put any expressions. Sorry.
No, don't apologize. We'll bring you back on. I do want to invite you to be one of our lived experience speakers as well, Urmila. So yeah, we'll have another session where you can share that with them, like you say.
Thank you.
Thank you. Can I don't want to leave without anyone having to ask their question. Can I just do a final call if anyone does have a question they want to ask?
There's no questions on the chat. There's a comment from Sylvia. This was a great session. I feel empowered in my journey through sight loss, equipped with the information and advice shared today. Thank you everyone for sharing your journey.
Amazing, lovely comment, and that's testament to each of our speakers today, Perm, Eamonn, Sandeep, and Beverly. Thank you all so much for sharing this, because I think we've done a number of webinars through BAME Vision and through other webinars that I do, and it's just been so paramount that mental health is something that isn't talked about enough, isn't prioritized. It affects us all at some point in our lives. And I can't thank you enough for actually sharing your tools, your resources, your own personal experiences. And like that comment just said, a sense of empowerment that there is, you know, hope, and there is a light at the end of the tunnel, pardon the pun that I've used again. But I just want to say thank you to all of you, and hope everyone has enjoyed the session. Apologies for running over, but thank you so much for bearing with us. Our next webinar for Live Well, See Well is on Thursday at the same time at 7 p.m. So hope to see as many of you there. Thank you so much and have a lovely rest of your evening.